Namaste students, खुश रहो बेटियों। I JVN Dr. Naren Singh Shekhar, Assistant Professor, Department of Shalya Tantra, Faculty of Ayurvedic Science, JAYOTI VIDYAPEETH Women's University, JAIPUR. In previous classes, we discussed about anatomy of kidney and ureter. In today's class, we will discuss about hematuria. Okay, students, let's begin. Hematuria. Hematuria is two types: gross and microscopic. Gross is visible to unaided eye. Microscope is greater than 5 IBC. Early initial hematuria, urethral origin, distal to external sphincter. Terminal hematuria, bladder neck or post origin. Diffuse total hematuria. Source is in the bladder or upper urinary tract. False hematuria. Discoloration of urine from pigments such as food coloring and myoglobin. Silent hematuria is due to tumors of kidney and bladder unless provided otherwise. Causes: renal injury, urinary stones, Wilms tumor, tuberculosis, renal cell carcinoma, cystitis, bladder tumor, urinary biliary BPH, carcinoma prostate, renal infarct, glomerulonephritis, blood crisis. In this picture, you can see the causes in this diagrammatic pic. Investigation: urinary and urinary culture and sensitivity test. Urine test for hematuria. This is called Benjamin test. Ultrasound to look for the stones, tumor in the urinary tract. Cysto Cystourethoscopy to look for bladder or urethral pathology. IV look for function of the kidney. Urinary cytology for diagnosing urethral malignancy. Bleeding time, clotting time, prothrombin time, platelets count. CT abdomen, renal function tests, blood urea, serum and creatinine. Management: cause should be identified and treated. Blood transfusion, antibiotics, nephroureterectomy for RCC, removal of stone from kidney, ureter, urinary bladder, treatment of bladder tumor by cystoscopic resection, intravesical chemotherapy using BCG radiotherapy and systemic chemotherapy, treatment of medical causes like glomerulonephritis, correction of BPH, correction of bleeding, diathesis. Okay, so this is all about the hematuria. I hope this session is powered by Digital Session 2.0 JAYOTI VIDYAPEETH Women's University Jaipur. I hope you are satisfied with this digital session. If you have any doubts and query, please mention in comment box. I will resolve it soon. Thank you, students. Namaste, students. खुश रहो बेटियों. I JVN Dr. Naren Singh Shekhar, Assistant Professor, Department of Shalya Tantra, Faculty of Ayurvedic Science, JAYOTI VIDYAPEETH Women's University, Jaipur. In previous class, we discussed about esophageal disorder like congenital anomalies of disorders, congenital anomalies, congenital anomalies of esophagus, like uh, like esophageal stenosis, tracheoesophageal fistula, etc. Now, today's class we will discuss about esophagitis. Esophagitis means inflammation of esophagus. These are the contents of this sessions: introduction, anatomy, histology, signs, symptoms, causes, grading of COT, complications, test and diagnosis, treatment. Start from introduction. It is inflammation that damages tissue of the esophagus, the muscular tube that diverts food from your mouth to your stomach. Esophagitis often cause painful difficult in swallowing and chest pain. Cause of esophagitis include stomach acid backing up into the esophagus, infection, oral medication, and allergies. Treatment of esophagitis depend on the underlying causes and the severity of tissue damage. It left untreated, esophagus may change the structure and function of the esophagus. This is the esophagus anatomy. This is the pathology of esophagus, histopathology. Mostly is mucosa, then submucosa, muscular layers, sign and symptoms. Abdominal pain, adenophagia. Adenophagia means pain when swallowing. Dysphagia means difficulty in swallowing. Food gets stuck in the esophagus, lack of appetite, nausea, and possibly vomiting, cough, pain when eating, heartburn, mouth sores, feeding difficulties, and subsequently possible failures to thrive in young children and this age. These are the symptoms of esophagitis. Causes most known causes GERD or GORD. GERD means gastrointestinal esophageal reflux disorders, known as reflux esophagitis. Allergens, some medications, infections like fungal, viral. This is the grading of severity of esophagitis: grade 1, grade A, grade B, grade C, grade D. This is the parameters of grading. Complications. Left untreated esophagus can lead to change in the structure and function of the esophagus. Possible complications include narrowing of the esophagus called esophageal structures, ring of abnormal tissue in the lining of the esophagus, it's called esophageal rings, Barrett esophagus, a condition in which the cell lining of esophagus are changed, a condition that a risk factor of esophageal cancer. Test and diagnosis. Barium X-ray, endoscopy, laboratory tests, and allergen tests. These are the tests for not treatment. Treatment for esophagus depend on its cause. Possible treatments include medications that block acid production such as heartburn, drugs, antibiotics, antifungal or antivirals to treat an infection, pain medication that can be gargled or swallowed, corticosteroid medication to reduce inflammations, intravenous nutrition to allow esophagus to heal and to prevent dehydration and malnutrition, endoscopic to remove any loose pills fragments, surgery to remove the damaged part of the esophagus. Lifestyle modifications. These are the lifestyle modifications: elevate the head of the bed 6 inch, stop smoking, reduce meal size, avoid bedtime snacks, reduce dietary fat, lose weight if overweight, avoid क्या avoid करना आपको chocolate, carminative, spearmint, peppermint, coffee and tea, cola beverage, tomato juice, citrus fruits juice, etc. These are the reference of these sessions. Thank you, students. Hope you are satisfied with this digital session powered by Digital Session 2.0 with Vidyapeeth Women's University. If you have any doubts or queries, please mention in comment box. I will resolve it soon. Thank you. Namaste students, I JVN Dr. Narendra Singh Segaut, Assistant Professor Department of Shalya Tantra, Faculty of Ayurvedic Science, JAYOTI Vidyapeeth Women's University, Jaipur. In previous class we discussed about definition, causes, etiology, pathophysiology of renal stone. In sequence, In sequence, today we will discuss about types and diagnostic techniques of renal stone to find out renal stone. Let's begin with types. Oxalate stone, also called as mulberry stone, as it is brown in color with sharp projection. It is invariably calcium oxalate stone, show envelope and crystals in urine. It is invariably calcium. It is invariably calcium oxalate stones, show envelope crystal in urine. Phosphate stones, 10 to 15%. It is either calcium phosphate or calcium magnesium ammonium phosphate stone, usually occurring in an infected urine. It is smooth and white in color. In an alkaline urine. It enlarges rapidly, filling renal calyx, taking their shape called as staghorn calculus. It is radiopaque and attains a large size. Uric acid stones are smooth, hard, yellowish, multiple, and radiolucent. They are seen in gout, hyperuricosuria. Urate stones. Cystine stones occur in cystinuria where there is defective absorption of cystine from the renal tubules. Autosomal recessive condition. It, it is seen in young girls, occur only in acidic urine. It is multiple soft yellow in color. It attains large size. It is radio opaque because it contains sulfur. Xanthine stone are very rare, smooth brick red in color due to altered xanthine metabolism. Here there is deficiency in xanthine oxidase enzyme. Indigo stones, very rare blue in color. Struvite stone, it is a compound of magnesium, ammonium phosphate and mixed with carbonate. It occurs in presence of ammonia and urea splitting organisms in urine. Example, Proteus, Klebsiella. Shape of crystals in urine. Ta- First, types and types correlated with shape of crystal. Calcium oxalate monohydrate crystal shape is dumbbell shape. Calcium oxalate dihydrate shape is envelope shape. Uric acid uric acid shape is yellowish of varying size and shape. Cystine hexagonal very soft stone. Triple stone shape is coffin lid shape. Clinical features. Pain. Renal pain is located over renal angle, hypochondrium, and lumbar region. Often severe, radiating to grow and test is in male with vomiting due to pylorospasm. Pain worsen on movements. Hematuria is common. Pyluria. Fever. Tenderness in renal angle with often a mass in the loin due to hydronephrosis, which moves with respiration and is bimanually transferable. Dilatable, smooth, soft, as urinary tract infection, often hypertension. Investigations: blood, ESR, serum, calcium, phosphate, creatinine, blood, urea, uric acids. Urine, calcium urate, cystine if suspected, only pH, specific gravity. Plain X-ray, KUB to see kidney shadows, stones. IBU to see renal function and hypertension. US abdomen can detect every radiolucent stone and give information about the changes in renal parenchyma. Urine analysis and culture and sensitivity to identify bacteria. Diagnostic studies. First of all, we can do cystoscopy, as you can see in this diagram. Then IVP, intravenous pressure. We can measure intravenous pressure in this. The USG. This is very unique uh, diagnostic tool for renal stone. Treatment part will start in next class. So student, this is about all about the types of renal stone and diagnostic techniques of renal stone. This session is powered by Digital Session 2.0 JAYOTI VIDYAPEETH Women's University, Jaipur. I hope you are satisfied with this digital session, digital version 2.0, powered by 2.0 JAYOTI VIDYAPEETH Women's University, Jaipur. I hope you are satisfied with this digital session. If you have any doubts and query, please mention comment box. I will resolve it soon. Thank you, students.